Hello everyone, in the current session let us discuss about ICD-10 conventions part 2. Here we are going to discuss about inclusion notes, inclusion terms, excludes notes, etiology and manifestation codes, convention and, with, C and C also, code also and default codes. First coming to includes notes. This note appears immediately under a 3-character code title to further define or to give examples of the content of the category. For example, under T56, which is nothing but toxic effects of metals, you can see includes note, which includes toxic effects of fumes and vapors of metals, toxic effects of metals from all sources except medicinal substances. So this particular code includes all these cases. That is the definition of includes note. Second example is T16 category, which is foreign body in ear. Under it you can find includes foreign body in auditory canal. That means whenever the physician documents foreign body in auditory canal, we can use the same code T16. Third example is A02, which is other Salmonella infections. Under this, you can also find includes notes, which include infection or foodborne intoxication due to any Salmonella species other than S. typhi and S. paratyphi. Coming to some more examples. Under E11, which is nothing but type 2 diabetes mellitus, you find includes note, which includes diabetes mellitus due to insulin secretory defect, diabetes NOS, insulin resistant diabetes mellitus. So all these terms are included in this particular code. Whenever the physician documents diabetes NOS, we need to go for E11 category, and similarly when he documents insulin resistant diabetes mellitus, we have to give E11. The next example is J44, which is nothing but other chronic obstructive pulmonary disease. In simple terms, COPD. Under COPD you can find includes, which include asthma with chronic obstructive pulmonary disease. So whenever the physician documents asthma with COPD, you need to code COPD only. Similarly, whenever he documents chronic asthmatic bronchitis, then also you have to code J44 series. And when he documents chronic bronchitis with airway obstruction, similarly chronic bronchitis with emphysema, chronic emphysematous bronchitis, chronic obstructive asthma, chronic obstructive tracheobronchitis. In all these cases, you have to code only J44 series. Coming to inclusion terms, a list of terms is included under some codes, and these terms are the condition for which the code is to be used. The terms may be synonymous of the code title, or in case of other specified codes, the terms are a list of various conditions assigned to that code. The inclusion terms are not necessarily exhaustive, and additional terms found only in the alphabet index may also be assigned to that particular code. Examples of inclusion terms are under S93 category, which is dislocation of sprain of joints and ligaments at ankle, foot and toe level. This code includes avulsion of joint or ligament. Whenever the physician documents avulsion of joint or ligament of ankle, foot or toe, you need to code S93. Similarly, laceration, for sprain, for traumatic hemarthrosis, traumatic rupture of joint, traumatic subluxation and traumatic tear. In all these cases, you need to code only S93. These are nothing but all the scenarios or all the terms for which only this code can be used. These are inclusion terms. Now coming to next convention, excludes notes. In ICD-10 there are two types of exclude notes, excludes 1 and excludes 2. Each type of note has a different definition for use, but they are all similar in that they indicate that codes excluded from each other are independent of each other. Whenever you find codes under excludes, you can assume that those codes are independent of each other. Now coming to excludes 1. Excludes 1, a type of excludes 1 note is a pure excludes 1 note. That means it means not coded here. Whenever you find excludes 1 under a code, you have to consider that those two codes should not be coded together. That is nothing but not coded here. An excludes 1 note indicates that code excluded should never be used at the same time as the code above the excludes note. An excludes 1 is used when two conditions cannot occur together, such as a congenital form versus an acquired form of the same condition. Examples. Under category A05.1, which is nothing but botulism, food poisoning, here you can find excludes 1 note, infant botulism and wound botulism. In these two cases, you should not use A05.1. In other words, A05.1 should not be coded along with infantile botulism or wound botulism. Other example is under E11 type 2 diabetes mellitus, you find excludes 1 note which includes diabetes mellitus due to underlying condition, drug or chemical induced diabetes mellitus, gestational diabetes mellitus, neonatal diabetes mellitus, post-pancreectomy diabetes mellitus, post-procedural diabetes mellitus, secondary diabetes mellitus, and type 1 diabetes mellitus. All these types of diabetes are excluded with E11.1. They should not be coded together. Now coming to exception for excludes 1. An exception to excludes 1 definition is the circumstance when two conditions are unrelated to each other. If it is not clear whether the two conditions involving an excludes 1 note are related or not, query the provider. Let us discuss one example, F48. F48 deals with other somatoform disorders which include psychogenic dysmenorrhea, psychogenic dysphagia, psychogenic pruritus, psychogenic torticollis, somatoform autonomous dysfunction, and teeth grinding. So here, when it comes to teeth grinding, here you can find excludes note for sleep related teeth grinding. Because teeth grinding is an inclusion term under F48.8, only one of these codes should be assigned for teeth grinding. Here, teeth grinding is an inclusion term under F48.1 and it excludes sleep-related teeth grinding. So, you should not give together F48.8 and G47.63. Because F48 includes only simple teeth grinding, whereas G47.63 it deals with sleep related teeth grinding. So both form of teeth grinding cannot exist. Similarly, if the physician documents psychogenic dysmenorrhea for a patient, for that you need to code F48.5, and if that patient has psychogenic dysmenorrhea and sleep-related teeth grinding. Here, psychogenic dysmenorrhea and sleep-related teeth grinding both are not related conditions. So, in that case, F45.8 for psychogenic dysmenorrhea can be coded along with G47.63 for sleep-related teeth grinding. This is an exception. An exception to excludes 1 definition is the circumstance when two conditions are unrelated to each other. When the two conditions are unrelated to each other, you can quote those two conditions together. If it is not clear whether two conditions involving an excludes one are related or not, we must query the provider. This is the exception for excludes one note. Excludes one note is nothing but pure excludes note. That means not coded here. This is the same example that we have discussed earlier. Now coming to excludes two note. A type of excludes two note represents not included here. An excludes two note indicates that the condition excluded is not a part of the condition represented by the code, but a patient may have both conditions at the same time. In simple words, whenever you find an excludes two note under a code, you can assume that the code above excludes two note and below can be coded together whenever appropriate. When an excludes two note appears under a code, it is acceptable to use both the code and the excluded code together when appropriate. Let us discuss one example. A18.6, which is a code for tuberculosis of inner and middle ear. Under this, you can find excludes 2, which includes tuberculosis of external ear and tuberculous mastoiditis. Here, whenever the patient has tuberculosis of inner ear and tuberculosis of external ear, you can quote both A18.6 and A18.4 together because they are excluded with excludes two terms, so they can be coded together. Coming to the next convention, etiology manifestation convention. The etiology and manifestation convention, it mainly deals with three conventions. The first is code first, use additional code, and in diseases classified elsewhere. So let us discuss in detail about each of these conventions. Certain conditions have both an underlying etiology and multiple body system manifestations due to the underlying etiology. For such conditions, ICD-10-CM has a coding convention that requires underlying condition to be sequenced first, if applicable, followed by the manifestation. Whenever an etiology condition, underlying etiology causes manifestations, the etiology code should be coded first and next the manifestation code. Whenever such a combination exists, there is a use additional code note at the etiology code and a code first note at the manifestation code. I repeat, certain conditions have both an underlying etiology and multiple body system manifestations due to that underlying etiology. For such conditions, the ICD-10-CM has a coding convention that requires the underlying condition to be sequenced first, if applicable, followed by manifestation. And whenever such a combination exists, there is a use additional code under etiology code and a use code first note at the manifestation. These instructional notes indicate proper sequencing order of the codes, etiology followed by manifestation. In most cases, the manifestation codes will have in the code title, that is in the code title itself, they have in diseases classified elsewhere. So whenever you find something like in diseases classified elsewhere, you can assume that that particular code is a manifestation code and it should be sequenced first with an etiology code. Codes with this title are a component of etiology manifestation convention. The code title indicates that it is a manifestation code, and in diseases classified elsewhere, codes are never permitted to be used as first listed or principal diagnosis codes. They must be used in conjunction with an underlying condition code, and then they must be listed following that underlying condition. For example, let us discuss the category F02, dementia in other diseases classified elsewhere, for the example of this convention. Now let us discuss about the example F02, dementia in other diseases classified elsewhere. Here you can see in the code itself, the other diseases classified elsewhere term is there. So by the definition itself, we can assume that this is a manifestation code and an additional code for etiology must be coded before it. Under that code, you can find code first. The underlying physiological condition such as Alzheimer's, cerebral lipidosis, dementia with Lewy bodies, dementia with Parkinsonism, epilepsy and recurrent seizures, frontotemporal dementia, hepatolenticular degeneration, human immunodeficiency virus disease, Parkinson's disease, vitamin D deficiency, etc. So before coding F02 series, we need to first code the underlying physiological conditions like Alzheimer's, Parkinson's or HIV disease, AIDS, etc. So this is an example for diseases classified elsewhere, and similarly the convention code first. The convention code first is given under the manifestation codes. And under these etiology codes, you will find code also or use additional code. Etiology manifestation convention. There are manifestation codes that do not have in disease classified elsewhere in their title. For such codes, there is a used additional code note at the etiology code and code first note at the manifestation code, and the rules for sequencing apply. In the alphabetic index, both conditions are listed together with the etiology code first followed by manifestation code in the brackets. Here you can find this when we discuss about the convention brackets. That is in our previous video. The code in brackets is always to be sequenced second, and the code in brackets will be the manifestation code. It must be always sequenced second. One more example for etiology and manifestation convention is dementia in Parkinson's disease. In the alphabetic index, if you search for Parkinson's disease, after Parkinson's disease, you can find G20 followed by a code F02.80 or F02.81 in brackets. This indicates this is a manifestation code and it must be always coded second. The code G20 represents the underlying etiology Parkinson's disease and must be sequenced first, whereas code F02.80 or F02.81 indicates dementia with behavioral disturbances, represents the manifestation of dementia in diseases classified elsewhere with or without behavioral disturbances. Some more examples for code first and use additional codes are also used in sequencing rules in the classification for certain codes that are not a part of etiology manifestation combination. That means the code first convention and the use additional code convention. It is used for other codes also which are not a part of etiology and manifestation combination. For example, under chronic kidney disease, CKD, you can find code first any associated diabetic chronic kidney disease or hypertensive chronic kidney disease. And you can find use additional code to identify the kidney transplant status. Where there is code first note, the underlying condition is present and the underlying condition should be sequenced first if known. Here, CKD is not a manifestation of diabetes, but CKD can coexist with the diabetic patient. So under CKD, you find code first any associated condition like diabetes or hypertensive chronic kidney disease. In these cases, if the patient is both diabetic and has chronic kidney disease, first we must use code for diabetes followed by code for CKD. Similarly, if the patient has hypertension and CKD, first you have to sequence hypertension code followed by CKD code. And additionally, if you have any kidney transplant status, we must use Z94.0 code. Coming to some more examples of code first, under B20, human immunodeficiency virus disease. Here you can find includes notes. Let us discuss all the conventions under B20. Includes note includes acquired immunodeficiency syndrome, AIDS related complex HIV infection and symptomatic HIV. In all these cases, we need to code B20. That is indicated by includes term. Under this, you also find code first. So before coding B20, if a pregnant woman is suffering from AIDS disease, we need to code first a code from O category O98.7 series before coding B20. So that is indicated by code first. And similarly, use additional code convention is to identify all manifestations of the HIV infections, if any. Then under it you find excludes 1. Excludes 1 means pure excludes note. So code B20 and code Z21, which is not, this is symptomatic HIV virus disease and this is asymptomatic human immunodeficiency virus infection. B20 and Z21 should not be coded together. That is included with excludes 1 note. And similarly, exposure to HIV virus and inconclusive serologic evidence of HIV virus. All these three cases should not be coded with B20. That is indicated by excludes 1. So this is the examples for includes notes, code first, use additional codes and excludes 1. Some more examples for use additional codes. Under B39 Histoplasmosis, you find code first, that is associated AIDS, and use additional codes for any associated manifestations such as endocarditis, meningitis, pericarditis and retinitis. So these are the manifestation codes which are indicated under an etiology code with use additional code. Here you can find examples of E06.0 acute thyroiditis. Here under it you can find use additional code to identify infectious agent which comes under the category B95 to B97. Another example is E06.4 drug induced thyroiditis. Here also you can find use additional code for adverse effects if applicable to identify T36 to T50 series to identify the drugs with the appropriate 5th or 6th character. Next is E11 type 2 diabetes mellitus. Even under type 2 diabetes mellitus, you find use additional code convention to identify the control. If it is controlled using insulin, you need to code Z79.4. If oral anti-diabetic drugs are used, you need to use additional code along with E11 series, that is Z79.84. One more example for diseases classifiable elsewhere is D77, other disorders of blood and blood forming organs in diseases classified elsewhere. This is also a manifestation code. Under this you can find code first convention which indicates code first underlying disease such as amyloidosis, congenital early syphilis, malaria, vitamin C deficiency, etc. Next is E35, disorders of endocrine glands in diseases classifiable elsewhere. This is also a manifestation condition which should not be coded first. So under it you can find code first underlying condition such as late congenital syphilis of thymus gland, and it also has use additional code if applicable to identify the sequelae of tuberculosis of other organs. Coming to the next convention, and. The word and should be interpreted to mean either and or when it appears in the title. So and can be considered as either and or or. For example, in the example causes of tuberculosis of bones, tuberculosis of joints and tuberculosis of bones and joints are classified to the subcategory A18.0, tuberculosis of bones and joints. Here you can see A18.0 indicates tuberculosis of bones and joints. Here and is considered as or, as it is in main term and is classified further. Here the and is considered as or because It is further classified as A18.01 for tuberculosis of spine and A18.022 tuberculous arthritis of other joints and A18.03 for tuberculosis of other bones. Here, in A18.0 series, tuberculosis of bones and joints and is considered as OR because you have separate code for tuberculosis of bones and tuberculosis of joints. The second example is A18.11 tuberculosis of kidney and ureter. Here and is considered as AND. That is, this code is applicable for both tuberculosis of kidney as well as ureter. Next is A18.32 Tuberculos Enteritis. This includes tuberculosis of anus and rectum, even tuberculosis of intestine. Here also AND is considered as AND. Coming to the next convention, with, which is very important. The word with or in should be interpreted to means associated with or due to. When it appears in a code title, the alphabetic index, either under the main term or the subterm or an instructional note in the tabular list. The classification presumes whenever a code is related with, two codes are related with, the classification presumes a causal relationship between the two conditions. These conditions should be coded as related even in the absence of provided documentation explicitly linking them, unless the documentation clearly states that conditions are unrelated or when another guideline exists that specially requires a documented linkage between the two conditions. Unless the physician documents, in simple terms, unless the physician documents that both the conditions are unrelated, the two conditions which are linked with should be always considered as related to each other. Now coming to the example, when you search in the alphabetical list for hypertension, under hypertension you can find with convention. So under with you can find heart failure, heart involvement and kidney involvement. Here the with indicates that these two conditions should be coded as related even though the physician does not document that they are related. So whenever there is heart failure with hypertension, you need to consider the code I11.0, not I10, which is a code for simple essential hypertension. Similarly, when there is kidney involvement, you need to use I12 or I13 series, which we will discuss in the further session. Here, let us discuss or focus only on with. With indicates that two conditions are related together and they must be considered a cause and effect relationship. Now coming to other example, diabetes. Under alphabetic index, if you search for diabetes, under diabetes you can find with. Here the with indicates that diabetes is related with amyotrophy, arthropathy, cataract, Charcot's joints, chronic kidney disease and circulatory complications. So whenever there is chronic kidney disease and diabetes, you have to go for the code E11.22 instead of E11.9 when it is type 2. If it is type 1, E10.22 and etc. So whenever they are related with, we must consider that both conditions are related together. So if the patient is suffering from cataract and the patient is diabetic, if the physician does not document that cataract is due to other condition, we must assume it is diabetic cataract and we must code E11.32 for type 2 diabetes and E11.10 for type 1, E13, E08 and E09 for the respective types of diabetes. Here let us focus only on the relation. Coming to next conventions, C and C also. The C instruction following a main term in the alphabetic index indicates that another term should be referred. C indicates another term should be referred. It is necessary to go to the main term referred with the C note to locate the correct code. When it comes to C also, a C also instruction following a main term in the alphabetic index instructs that there is another main term that may also be referred, that may provide additional information. It is not necessary to follow the C also note when original main term provides necessary code. Coming to cross-reference notes. The cross-reference notes used in the alphabetic index to advise the coding professional to look elsewhere before assigning a code. C, C also and C condition, all these things are cross-reference notes. They advise the professional, coding professional, to look elsewhere before assigning a correct code. Examples. Let us see some examples. If you search for hemorrhage, cranial, you can see hemorrhage intracranial. That means you have to go for intracranial section in the hemorrhage. Similarly, labyrinthitis. You can see also subcategory H83.0. Here you can see also just for further reference, but here a code is given. Whenever C is given, here a correct code is not there and you must refer this term for the correct code. Similarly, if you see lumbar, it indicates C condition. That means you have to search for the condition. That is whether it is DJD or stenosis, such that. Some more examples. C usually seen with excludes note and it indicates to refer the term before coding. Here you can see G56, mononeuropathies of upper lip. In that excludes note, it includes current traumatic nerve disorder, and you can see this cross-reference note C. C nerve injury by body region. That is, before coding this, we must see the nerve injury by body region. Another example is I-96, gangrene not elsewhere classified. It excludes 1, gangrene in atherosclerosis of native arteries of the extremities, and gangrene in hernia, gangrene in other peripheral vascular diseases. Gangrene of certain specified sites. In gangrene of certain specified sites, you see C is the cross-reference note. It indicates alphabetic index gas gangrene. That means you have to refer this code before assigning this. One more example is L81, other disorders of pigmentation. Here under excludes 2, you see nervous. So before assigning a code for nervous, first we have to search the alphabetic index. Coming to next convention, code also note. A code also note instructs that 2 codes may be required to fully describe a condition. But this note does not provide sequencing direction. Code also does not provide sequencing direction, whereas code first will provide the sequencing direction. The sequencing depends on the circumstance of encounter in case of code also. The code also note instructs 2 codes may be required to fully describe a condition. Now examples of code also. In this M07, enteropathic arthropathies. So before coding enteropathic arthropathies, under it you can see code also associated enteropathy. An enteropathy must be associated with enteropathic arthropathies such as regional enteritis or ulcerative colitis. That is why it is indicated with cross-reference note code also. Another example is F80.4, speech and language development delay due to hearing loss. So we also need to code type of hearing loss to complete this code. That is why it is indicated with code also. Some more examples are G43.6, persistent migraine aura with cerebral infraction. Here also you can find code also the type of cerebral infraction. Here G43.6 is persistent migraine aura with cerebral infraction. So you need to add additional code to indicate type of cerebral infraction. Hence it is indicated with code also the type of cerebral infraction. Another example is H05.32, deformity of orbit due to bone disease. Code also the associated bone disease. Next, coming to default codes. A code listed next to the main term in the ICD-10-CM alphabetic index is referred to as default code. And the default code represents that condition that is most commonly associated with the main term or the unspecified code of the condition. If the condition is documented in medical record, for example, appendicitis, without any additional information such as acute or chronic, the default code should be assigned. That is, whenever you search for appendicitis, there will be a code next to the main term, and that is the default code. If there is no any further additional information. Coming to code assignment and clinical criteria. The assignment of diagnosis code is based on the provider's diagnostic statement that the condition exists. The provider's statement that the patient has a particular condition is sufficient. Code assignment is not based on clinical criteria used by the provider to establish the diagnosis. In simple terms, to assign a code, physician's statement is sufficient, not the clinical criteria that is used by the provider to establish the diagnosis. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.